नमस्ते नमस्ते बिटिया हमेशा खुश रहो बिटिया A very good morning to you all. Myself JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series of lectures, we are discussing about the different hematological disorders. In today's lecture, we are going to discuss about leukemia. So today we are going to start with acute leukemia. And I believe you must all have gone through the notes that I have provided to you in the previous lectures. And also you had made the notes from the books, and you must all have completed the homework that I have given to you. So let's start with the today's lecture of acute leukemia or the acute leukemia. So what is leukemia? Leukemias are basically the malignant disorders of the hematopoietic stem cell compartment. So what are leukemias? Leukemias are basically the malignant disorders. So leukemias are pertaining to malignancy of the hematopoietic stem cell compartment, and it is characteristically associated with increased number of white cells in the bone marrow. So what is happening in leukemia? These are basically the malignant disorders of the hematopoietic stem cell compartment, and these are associated with the increased number of WBCs or the white blood cells in the bone marrow and the peripheral blood film. So these are the leukemias. What are leukemias? These are basically the malignant disorders of the hematopoietic stem cells, and these are associated with increased number of white cells in the bone marrow and peripheral blood film. In leukemias, the bone marrow produces abnormal white cells. So this is not only related to the white cell production, but the white cells that are produced are abnormal. So these are abnormal white cells that are produced in the bone marrow, and these WBCs do not function properly. So despite of having large number of WBCs, they are not able to fight against the infection. Now, what is epidemiology? Epidemiology of leukemia is that it is affecting all type of population. So all type of people are getting affected with leukemia, and males are affected more than the females. So among the general masses, males, leukemia is more common in males as compared to the females. The ratio varies according to the type of leukemia. So the ratio of the leukemia, it varies according to the type of leukemia. So it is affecting all type of population, and the ratio is varying according to the type of leukemia. So that we are going to discuss one by one. What is the etiology of leukemia? The exact etiology of development of leukemia is unknown in majority of the patient. But there are certain factors that are associated with the development of leukemia. The factors includes ionizing radiations. There are different type of ionizing radiations that are seen. We have cytotoxic drugs. So we have ionizing radiations, we have cytotoxic drugs. There are different type of retroviruses, genetic and immunological factors that are responsible. So what is epidemiology? It is affecting all type of population. The ratio of male to female is varying with the different type of leukemia that we are going to discuss one by one. The exact etiology for majority of the leukemia is not known, but there are various factors that are associated with the development of leukemia that includes ionizing radiations. We have ionizing radiations, we have cytotoxic drugs that includes the retroviruses, genetic and immunological factors that are associated. So ionizing radiations, cytotoxic drugs, retroviruses, genetic and immunological factors are associated for the development of leukemias. Now, what are the symptoms of leukemia? Whenever a patient of leukemia is coming to us, what are the different signs and symptoms with which a patient can come to us? The signs and symptoms of leukemia includes this, the leukemia symptoms may vary depending upon the type of leukemia. So depending upon the type of leukemia, the symptoms can vary. The most common symptoms of leukemia includes, we will have fever or chills. So there will be presence of fever or chills. There will be persistent fatigue and weakness. So patient will always complain of fatigue and weaknesses. There will be fever, there will be chills. The patient will always complain of fatigue and weakness. There will be frequent or severe infections. So infections will be very much common in such patient because of the WBCs that are not properly functioning. The patient will be losing weight without trying. So in any sort of malignancy, in any sort of cancer, there is a progressive weight loss. So the patient will be losing weight without even trying to lose weight. There will be swollen lymph node and enlarged liver and spleen. So the lymph node will be swollen and there will be enlarged liver and spleen that you are going to see in case of leukemia. And there will be tendency for easy bleeding and bruising. So because of that tendency to bleed and bruise, you are going to observe recurrent nosebleed. So there will be recurrent nose bleeding. And in this mechanism, you are also going to see tiny bleeding spots on the skin that are known as the petechial spots. Tiny, small little bleeding spots will be seen on the skin that are known as petechial spots. There will be excessive sweating, and especially at the night. So the patient will also complain of excessive sweating, especially at night, and there will be bone pain or tenderness. So I will again repeat the symptoms of leukemia. Whenever a patient of leukemia is coming to us, the symptoms may vary depending upon the type of leukemia. So some sort of the symptoms are going to vary depending upon the type of leukemia from which the patient is suffering. The most common symptoms includes fever and chills. So there will be fever, there will be chills, there will be persistent fatigue and weakness. So patient will also complain of persistent fatigue and weaknesses. There will be frequent or severe infections. So the patient can also complain of severe infections, severity of the infections. The patient might lose weight without even trying to gain the weight. So there will be persistent fatigue, weakness, and he might be losing weight without even trying to lose weight. The lymph nodes will be swollen and there will be enlarged liver and spleen. There will also be easy bleeding or bruising. The patient will also complain of recurrent nosebleeds. So there will be nosebleeds with tiny red spots on the skin that are known as petechial hemorrhages. There will be excessive sweating, and especially at the night. The patient will also complain of bone pain and tenderness. Next, we come to the classification of leukemia. Broadly classifying, the leukemia can be classified into two varieties, acute leukemia and chronic leukemia, which further can be classified into many subgroups. So leukemia is classified into two types. We have acute leukemia and we have chronic leukemia. Acute and chronic both are again of two types each. So in acute leukemia, it is of two types. We have acute lymphoblastic leukemia, that is ALL, and acute myeloid leukemia, that is AML. So in the acute leukemia, we will have acute lymphoblastic leukemia, that is ALL, and acute myeloid leukemia, that is AML. The chronic type is again of two types, that is chronic lymphocytic leukemia, that is CLL, and chronic myeloid leukemia, that is CML. So acute is of two types, acute lymphoblastic leukemia, that is ALL, acute myeloid leukemia, that is AML. So we have one acute lymphoblastic and acute myeloid leukemia. In the chronic variety, again, lymphocytic leukemia and myeloid leukemia. So now talking about these varieties, first of all, we will talk about the acute lymphoblastic leukemia, that is ALL. It is the most common type of leukemia in young children. So ALL, that is acute lymphoblastic leukemia, it is more common in the children. The blast cells arise from the committed lymphocyte cell line. So the blast cells are arising from the committed lymphoid cell line. The acute myeloid leukemia, that is AML, is a common type of leukemia in adults. So acute myeloid leukemia is a common type of leukemia in adults, and the precursor cell involved in the malignant process have normally matured to the RBC, granulocytes, and platelets. So acute lymphoblastic leukemia, that is more common in children, and the blast cells arises from the committed lymphoid cell line. The acute myeloid leukemia, AML, it is a common type of leukemia in the adults. The precursor cell involved in this malignant process would have normally matured to RBCs. So in case of acute myeloid series, this is a common type of leukemia in the adults. The precursor cells involved in this particular type of malignant process or the disease would have normally matured into RBCs, mature RBCs, granulocytes, or platelets. This series we have already discussed in the last lecture, that what are the different precursor cells, what is the cell lineage. I believe you must all have gone through the previous lecture, and now it is very easy to understand for you all these things. So this was about acute leukemia. In the chronic leukemia, first of all, the chronic lymphocytic leukemia, With the chronic lymphocytic leukemia, it is the most common chronic adult leukemia. So chronic lymphocytic leukemia is the most chronic adult leukemia, and you feel it for years without needing the treatment. So chronic lymphocytic leukemia keep on going for years without even needing a treatment. And next is chronic myeloid leukemia, CML. In this type of leukemia, it mainly affects the adults. A person with CML may have few or no symptoms. So in the chronic myeloid leukemia, this is mainly affecting the adults, and a person with this particular type of leukemia may have few symptoms or no symptoms at all for months or years before entering a phase in which the leukemia cells grows more quickly. Other type of cells are a rare type of leukemia that exist. Other type of leukemia includes hairy cell leukemia, myelodysplastic syndrome, and myeloproliferative syndrome. So the other type of leukemia that exists includes the hairy cell leukemia. We have hairy cell leukemia, we have myelodysplastic syndrome, and we also have myeloproliferative disorders. Next, we come to the acute leukemia. So today we are going to discuss about acute leukemia as well. Acute leukemia, as I have discussed, it is of two types. So what is acute leukemia? So leukemia that is coming in the acute phase. There is proliferation of the cells which do not mature. So there is excessive proliferation of the cells that do not mature to an accumulation of useless cells. So in acute leukemia, what is happening is there is proliferation of the cells which do not mature. So there are excessive accumulation or the proliferation of the cells, and these cells do not mature, lead to the accumulation of useless cells, which take up more and more marrow space and at the expense of normal hematopoietic element. So what is happening in the acute leukemia? There are a lot of cells that are accumulating in the bone marrow, and these are useless cells. They do not perform any of the function, and these are occupying more and more space, more and more lesion in the hematopoietic element. It is of two types: acute myeloid leukemia and acute lymphoblastic leukemia. Acute myeloid leukemia is 4 times more common than the acute lymphoblastic leukemia in the adults. In children, acute lymphoblastic leukemia is more common. Now, what is the etiology of acute leukemia? As we all discussed, that the exact pathophysiology of leukemia is not known. It is not clear, but there are certain factors that are responsible for development of acute leukemia. They include radiations which are responsible for the nuclear disaster, or radiotherapies, etc. There are different types of drugs or chemicals that are responsible for development of leukemia, which includes chronic benzene exposure, use of cytotoxic and immunosuppressive drugs. So we have chemicals and drugs like the chronic benzene exposure, use of cytotoxic and immunosuppressive drugs. There are also different types of genetic disorders like the Down syndrome and Klinefelter syndrome, etc. Various types of viruses, which includes human lymphocytic virus type 1 infection. So etiology, we have unknown etiology. There are different types of radiations, which includes nuclear disaster, radiotherapy, etc. Different type of chemicals and drugs, which includes chronic benzene exposure, use of cytotoxic immunosuppressive drugs, genetic factors, which includes disorders like Down syndrome, Klinefelter syndrome, different type of viruses, which includes a human lymphocytic virus type 1. Now, what are the various clinical features that are seen in case of acute leukemia? So most common signs and symptoms result from the bone marrow failure. So the most important signs and symptoms of acute leukemia are resulting from the bone marrow failure or the organ infiltration. So there is bone marrow failure, there is organ infiltration, and it can be abrupt or insidious slow onset. There will be symptoms of anemia like tiredness, fatigue, and marked pallor. There will also be hemorrhagic manifestations, which includes petechial hemorrhages. There will be bruises, bleeding from the gums and the nose. Easy bleeding tendency will be there. Different type of infections will be seen that includes infective lesions of the mouth and throat, lesions of the anus, rectum, vaginal ulcerations, respiratory tract infections, bronchitis, pneumonia, and skin cellulitis. So we are going to observe symptoms of anemia like tiredness, fatigue, weakness, and pallor. Hemorrhagic manifestations, which includes skin, petechiae, bruises, bleeding from the gums and nose. Infections, which includes mouth and throat, anal, rectal, vaginal ulcerations. Because of the excessive proliferation of the cells, there will be hyperviscosity of the hyperviscosity symptoms will be present that will lead to development of headache, the confusion, fits, and focal neurological signs and coma. There will be tissue deposits of the leukemic cells that will be seen in form of gum hypertrophy. There will also be lymphadenopathy and hepatosplenomegaly. So the lymph node will be enlarged and the hepatosplenomegaly will be there. This will ultimately lead to the organ failure. Different type of organ failure will be observed, like renal failure. There will also be bone pains. Bone pains includes the common osteolytic bone lesions, the pathological fractures, etc. Bone pains, common osteolytic bone diseases, bone lesions, pathological fractures, etc. And there will also be constitutional symptoms like fever, malaise, and prostration. Now, how to diagnose such case? What are the various investigations that could be done in case of acute leukemia? In case of AML, the investigations that will be done includes total WBC count that will be greater than 5 lakh per cubic millimeter of blood. The peripheral blood film will show increased number of typical and atypical myeloblast. Aor rods will be present in the cytoplasm. This is the takeaway word for you, Aor rods. These will be present in the cytoplasm. That is a diagnostic feature of AML. The bone marrow will be greater than 30% of the blast cells. The marrow entirely replaced by the myeloblast and promyelocytes. So in the bone marrow, there will be 30% of the blast cells and marrow is entirely replaced by myeloblast and promyelocytes. There will be positive Sudan-Black reaction. Next, we come to the ALL, the investigations in case of ALL. The total WBC count in ALL will be greater than 50,000 per cubic millimeter of blood. The bone marrow will be hypercellular and there will be depression of the normal erythropoiesis, granulopoiesis. In comparison to the myeloblastic leukemia, the nuclei are round, the cells are smaller, the nuclear cytoplasmic ratio is higher, and the number of nucleoli are fewer. Now, how to manage a case of leukemia, acute leukemia? Whenever a patient is coming to us, how can we manage such case? Because this is an acute emergency, we have to provide chemotherapy that will be conducted in 3 phases. The 3 phases will include chemotherapy, induction phase, consolidation phase, and the supportive care. So in the induction phase, the initial high dose of chemotherapy is given to reduce the leukemic cells below the level of morphological detection. So what we are doing in the induction phase, we are giving high doses of chemotherapy in order to reduce the leukemic cells below the level of morphological detection. So this is the induction phase. Next is the consolidation phase. In the consolidation phase, another dose of chemotherapy is given to further reduce the leukemic burden. So we have done the induction phase, then the consolidation phase. Third is the maintenance phase in which the doses are maintained. Low dose of chemotherapy is administered for a period of 18 months to 2 years. So in the chemotherapy, we have 3 phases: induction phase, consolidation phase, and the maintenance therapy or the maintenance phase. In induction phase, high dose of chemotherapy is given. In consolidation phase, another dose of chemotherapy is given. And in the maintenance therapy, low dose of chemotherapy is administered for a longer period of time, which includes 18 months to 2 years. Next, we will get bone marrow transplantation that could be done. Supportive care will be done for maintenance of anemia and infection. So in order to treat the anemia, transfusion of RBC or platelets is done. And for the management of infection, good nursing care and isolation, antibiotics are usually given to the patient. So this was all about leukemia and acute leukemia. In the next lecture, we are going to discuss about the chronic leukemia. So this session is powered by digital version 2.0 JAYOTI VIDYAPEETH Women's University. I hope the session is clear to you. If you have not understood anything, you can write in the comment box and I'll try to resolve it. I have also uploaded the e-notes on the portal of this particular session, and I believe you all must go and see from the book about this particular topic. So this is all about leukemia, acute leukemia. In the next lecture, we will be discussing about chronic leukemia. So this is all for today. Thank you very much. Have a good day.